Hello, I want to welcome everyone to our MRC First Statewide Training. This is Adrenia Tolliver. I'm the Public Health Preparedness Training Coordinator at VDH. I'll be working closely with Jennifer Freeland, which I'll introduce in a minute for those who may not know her, on coordinating MRC training going forward. So I just want to again welcome everyone. You are on mute, and this session is being recorded. So if you have any questions, if you can just type them in the chat box, and we will address those questions, the presenters will, at the end of the session. Please make sure that you register on Train with the course number 1061227, 1061227. So make sure you do register on Train to get credit for this training. And someone says I'm breaking up, so I want to make sure that you can hear me. I hope that's better. If someone can let me know if I'm still breaking up, and I will try and correct that. So again, I'd like to welcome everyone on the line. So those are the little housekeeping notes. Again, this call is being recorded. And if you have any questions or concerns, please make sure that you type them in the chat box, and we will address the questions at the end of the presentation. Great, thank you. I'm sounding better. Sounds good. I want to go ahead and give you all some information and present our presenters by reading or telling you a little bit about them, about their bios. So we are very fortunate this evening to have Captain Rob Tasato with us. A lot of you may know him already. He serves as the Director of the Medical Reserve Corps Program under the Partner Readiness and Emergency Program Division, and is the Principal Advisor to the Assistant Secretary for Preparedness and Response and the Director of the Office of Emergency Management on issues of civilian volunteers and their participation in public health initiatives and emergency preparedness response activities. He is a strong advocate for reducing disaster risk, building community resilience, and engaging young members of our society in these efforts. He is directly responsible for overseeing the establishment, implementation, and coordination of MRC units in communities nationwide. Captain Tasato has been a U.S. Public Health Service officer since 1988 and has previously completed tours of duty with the Office of Global Health Affairs, the Substance Abuse and Mental Health Service Administration, and the Indian Health Service, including assignments on the Fort Hall, Pine Ridge, and Navajo, I'm sorry, I mispronounced that, reservations. He has been deployed on numerous occasions, including response missions following the Anthrax Mailings in 2001, Hurricane Katrina, and several humanitarian and national special security events. He is a recipient of numerous awards, including the USPHS Meritorious Service Medal and the Surgeon General Medallion. He holds a bachelor's degree from the University of Pittsburgh School of Pharmacy and master's degree in public health and business administration from the University of Alabama at Birmingham. Captain Tasato is married and has 4 children, and he strives for balance in his life and enjoys spending much of his free time being outside and staying active, such as rock climbing, kayaking, hiking, snowboarding, mountain biking, just to name a few things that he does. So we'd like to welcome him to our presentation today. And then we have Ms. Jennifer Freeland, and a lot of you know her already, but if you don't, she is the State Volunteer Coordinator for Virginia Department of Health. She is responsible for coordinating the 27 Medical Reserve Corps units and over 10,600 public health volunteers throughout Virginia in their everyday and emergency efforts to support public health. An important part of her position is the coordination of the Virginia Department of Health Virginia Volunteer Health System, which is used to register, credential, and track and alert public health volunteers. Ms. Freeland has been in the MRC program since 2004 and was previously the coordinator for the Peninsula and Western Tidewater MRC units. In 2013, Ms. Freeland received the Division of Civilian Volunteer Medical Reserve Corps Elizabeth Fitch Leadership Award for outstanding leadership and commitment to the Medical Reserve Corps. Ms. Freeland's educational experience is valuable in her efforts to support the development of public health volunteer programs. She has provided instruction and presentation in small group communication, public speaking, human communication, leadership, strategic planning, volunteer management, partnership development, and organizational behavior. Ms. Freeland received her MA from the University of North Carolina at Greensboro in Organization Communication and Ethics. And she also has a BS in Communication from Old Dominion University in Small Group Communication and Psychology. So we are so glad to have these two presenters joining us today, and I will turn the mic over to Captain Tasato.
Good evening, everybody, and thank you, Adriana, for the long but kind introduction. Before I start, I really want to thank all of the participants on the line tonight. For attending, but also for your hard work every day as a member or leader of the MRC and the support that you give your community every day. Know that your work is much appreciated, it is valued, and it is noticed. So thank you very much. I'm going to talk today a little bit about the history of the MRC, kind of where we've come from at the national level, the Mrc Network. But I'm also going to talk more about the present, where we are, and maybe guess a little bit about where we're going to go in the future as well. So if we can go to the first slide. The MRC started really as a concept following the events on 9/11. And I'm sure that everybody has vivid memories of that day. Next slide, please. We saw the events happen. Some we witnessed close by, others we saw on the screen. Many people wanted to help. Many people needed to help, and that included medical and public health professionals. It included folks who went to the crash sites, who went to local hospitals, saying, what can I do to help? I need to help. Unfortunately, there was really not a system in place at that time to allow those folks who wanted to help to do so. The volunteers, showed up at the sites. They wanted to be there. The emergency managers, they became frustrated a bit because, here were all these people that wanted to help, but they couldn't. So shortly thereafter, about a month later, we had the Anthrax Mailings and the Anthrax attacks and the need to get medication into a lot of people quickly, including thousands and thousands of postal workers in Washington, D.C., in New York, with the congressional staff members who may have been exposed. Next slide, please. I responded on 6 of those missions for anthrax, and many more of my colleagues, both within the Public Health Service, in the federal government, with the National Disaster Medical Systems teams. And one thing that, after and during the response, when we talked about it, we talked about if this was a bigger event, if it wasn't just the thousands of people that we were seeing, but if it was the tens of thousands or hundreds of thousands or millions of people that were affected. Our small teams that we had, were not big enough, that this was going to need volunteers, that this was going to need, more than just us to do this. So with those events in September, October, November of 2001, and after that, some great minds got together and, came up with the blueprints for what has become the Medical Reserve Corps. Some of this was sketched out on napkins and scraps of paper over chats. It got into kind of congressional testimony. It became talked about at the highest levels within the White House. The MRC was started then in 2002 as a demonstration project, basically as a test concept. If we build this thing, if we put this idea out there of having volunteers to assist with public health, routine day-to-day, but then also to prepare and train and respond to emergencies. If we put this concept out there, will people do that? Well, as you know, the MRC network exists because resoundingly the communities that were part of that demonstration project said, yes, it is feasible. So the MRC is a national network. It started off as a demonstration project in 2002. I was brought on in 2003 to turn it into a program, to make it more than just that, that short, idea project. So it is a national network. It's community-based. It means that the community is in charge, that we at the federal government are not creating a franchise. We aren't telling communities exactly how they have to do the MRC. We give out guidance, we give out suggestions, and then the community decides how best to organize, how best to recruit, how best to utilize those volunteers. What we do at the national level is provide that broad support for the network, that national network of MRCs, so that overall our national network mission is to engage the volunteers, to strengthen public health, to reduce vulnerability, to improve preparedness, response, and recovery capabilities, and ultimately to build community resilience. So, next slide, please. So where have we come? So in the 13 plus years now that the MRC has existed, we have grown. We have grown from that initial 42 MRC units of the demonstration project to just under 1,000 MRC units today. We are covering about 90% of the U.S. population and about 74% of the land area. We are in 49 states. We are in most of the territories, as you can see. As you look at this slide with the map, the grayed out areas are those the jurisdictions that are covered. So you see we have many areas that are fully covered by the MRC. The white areas are those that don't have coverage. You'll notice one thing is that many of those areas are more rural, and so that is something that we continue to work on, is to still get to some of those, get MRCs started in some of those areas, but it's really up to, as we said, it's up to the communities to decide if they want an MRC there or not. All right, next slide, please. So the strength of the MRC is really its volunteers, as you all know. Currently at the national level, there are 200,000, roughly 200,000 MRC volunteers around the nation. About 2/3 are medical and public health professionals, such as nurses, as you see, are the largest category of volunteers, but physicians, pharmacists, mental health professionals, EMS professionals, and then a broad range of other medical and public health professionals as well. And about 1/3 of the MRC volunteers are support personnel that help out with all the things that you don't need a clinician for, the leadership, the administration, logistics, operations, communications. I see a question about nurses. It's RNs, LPNs. We do separate out the nurse practitioners in that count. But yes, when we list the nurses, that's both RNs and LPNs. Okay, so we have numbers. We have numbers of units. We have numbers of volunteers, and that's great. That has been something that has been beyond the imagination when we first started the MRC. That would be at so many volunteers and 1,000 MRC units. So the numbers are nice, but really, so what? What are MRC units doing? That is really what it comes down to for impact, and what we need to continue to do and continue to show for us to be successful. Next slide, please. So MRCs are active. As you can see, in the last fiscal year, we had almost 18,000 activities reported nationwide by MRC units. Next slide, please. With a donated value of over $10 million. And that's just the economic equivalent of that donated time. That doesn't take into account the real impact of the diseases prevented and lives saved by the activities of the MRC volunteers. So what are some of those activities that MRCs have been involved in? Next slide, please. They include things that MRCs do for preparedness. That's the activities they do to prepare themselves. MRC volunteers preparing themselves and their families to make sure that, if something happens, they're personally prepared so that they're more likely to respond and assist. It's what they're doing to prepare the MRC unit, doing the training and drills and exercises together and with partners so that they know they can respond. And then it's also the wonderful things that you all do to prepare your communities, going into community fairs and community events to talk about preparedness and what needs to be done to be prepared, to have communications plans, to have emergency kits, to know what to do during an emergency. Next slide, please. Of course, MRCs are also very active when it comes time to be, when there is an emergency. We've seen MRCs active for many, many years with hurricanes like Hurricane Katrina, Hurricane Ike, Gustav, Hurricane Sandy just a few years ago, with tornadoes, with flooding, with snow or ice storms, such as we just experienced this past week. We had MRCs involved with Ebola. We've had MRCs involved with mass vaccinations following H1N1. It's really up to the community and the state to determine what types of emergency responses that MRC volunteers are going to be involved in. It can be things like shelter support following an evacuation. It can be behavioral health. It can be providing support to the Emergency Operations Center. It might be providing vaccinations or dispensing medications to folks who need it. It can be working in a hospital, helping out with medical surge. There are a number of different ways that MRCs have been involved, but also can be involved when necessary. Next slide, please. But MRCs also help every day in those steady states, routine things that happen just every day to improve public health. These are things that the health departments oftentimes want to do, but if they don't have the sufficient staff numbers to do so, they can't meet those missions. And the MRC volunteers can and do help out. Next slide, please. One of the ways that MRCs help in steady state is also tied to disasters by reducing disaster risk. Risk is a function of the hazard itself and then the vulnerabilities of individuals or the community to that hazard. And that vulnerability is a function of the exposure, whether you're facing that hazard, your susceptibility to it, and then also the resilience. Next slide. And so the MRC, kind of those steady state routine activities, they help to build resilience. They help to build resilience because the MRC volunteers are working together. They're showing that social connectedness with each other as volunteers, but also with the community members. So that helps to build resilience. It shows that there are redundant resources in place that can assist. That helps to build resilience. MRC volunteers and those routine activities, those steady state activities, can help to reduce exposure. They can help to reduce susceptibility. By having people that are healthier routinely, day to day, it helps to reduce that susceptibility when they face a disaster. So where are we going in the future with the MRC? One of the areas is having a strong footprint with national health security and the national health security strategy. And national health security is a state in which the nation and its people are prepared for, protected from, and resilient in the face of incidents that have potential negative health consequences. Just about everything the MRC does, helps to improve national health security. The strategic priorities of the national health security strategy, we can talk about how MRCs build and sustain healthy, resilient communities. the MRC absolutely has a role there. The ability to enhance and distribute medical countermeasures. The MRC can do that. They can help to dispense medications or provide those vaccinations that are developed. Providing situational awareness. We absolutely count on MRCs nationwide to let us know what is happening at that ground level so that we can bring it up to the highest levels. I'll tell you about a story when there's recently been an HIV outbreak in Indiana. We got word of it through the local medical reserve corps coordinators well before it hit major media, well before it hit some of the other avenues. So we were able to provide that situational awareness up through the HHS Secretary's Operations Center so that they had information about it before it was hitting the routine, the normal channel of information. But we also don't want it to be a one way of information coming up from the MRC units up the chain. We want to make sure that we're providing that situational awareness out to the MRC, both the state and local coordinators as well. So we make sure that that's a two-way situational awareness. The MRC is in the fourth priority there, enhancing the integration and effectiveness of public health, healthcare, and emergency management systems. The MRC certainly has a role there. That's the workforce. That's where MRC is day to day, is really building up that scalable, integrated system that involves public health, involves emergency medical services, involves emergency management, involves hospitals. And the MRC volunteers are very strongly represented in that priority. With the strength in global health security, you may not initially think that the MRC has a strong role to play there, and you may be somewhat correct, but think about the role that the MRC has along the borders with Mexico, has activity along the border with Canada, but also with the activities that MRCs do into various communities in their states. During Ebola, one of our MRC units up in Minneapolis reached out into, they have a strong West African population up there. And the MRC unit has a cultural services unit that reached out into that community, talked about Ebola, gave them good information. A lot of what was being talked about in the media was not good information, so they gave good, accurate information. And that helped that community here in the United States, but also many of those people keep in touch with their families back in Africa, and were able to provide that information back home as well. So that did have that global health effects there as well. All right, next slide, please. So something that we need to continue to do, and this goes back to the impact, is that we need to continue to demonstrate the capability and capacity of MRC units. We certainly want strong and active MRC units and strong and trained and prepared and dedicated volunteers. So we need to show what we are capable of doing and then to what extent. So this is going to be a big focus of the MRC in the next few years. So what is this going to look like? We're not exactly sure yet. But what we want to be able to do is for each MRC unit, for each MRC state coordinator, for us in the national office, that if we get a question asked of us of, could, X MRC provide, shelter support? Could they provide mass vaccination? Could they provide medication? So any of those different mission areas, if that's part of that MRC unit's mission, then we need to be able to show that, yes, answer that question, yes, they're able to do that, and then to what extent can they do it. One of the things we're looking at, next slide, is a set of mission-ready packages. These would be specific functional areas that MRCs can work towards fulfilling. We're working with colleagues at the Association of State and Territorial Health Officials, the National Association of County and City Health Officials and the National Emergency Management Agency on the development of a set of mission-ready packages specific to the MRC. So do look forward to those coming in the near future. I believe we're going to develop 3 different mission-ready packages this year, and then see what development for future might look like as well. Next slide, please. One of the areas I'm really passionate about, and I think MRCs nationwide really need to consider, is the future of the MRC, not just kind of the next year or next couple of years, but kind of generational succession planning. Where are we going in many years to come? And so we really need to look at youth engagement. We've worked with an organization called HOSA, Future Health Professionals, for many years, but we're also working with organizations like 4-H. And I know many MRC units work with groups like the Boys and Girl Scouts or Boys and Girls Clubs. Really the point here is that we want to make sure that youth are engaged with the activities of the MRC. They don't necessarily have to be members of a local MRC if regulations or practices in that area don't allow them to be members. But we want to make sure at least that the MRC is partnering with youth organizations that are getting them interested in public health, getting them interested in preparedness, getting them interested in all of the various missions of the MRC, so that as they grow in their career, in their interest, either as public health or medical professionals or outside of that they are interested in this area, that they're doing things to get prepared, that they're helping to prepare their community, that they're helping to improve the public health of their communities. One of the things we've done with our partners at HOSA and released last year are a series of guides. Next slide, please, on basically how to work with youth engagement in the Medical Reserve Corps. And we developed guides for students, for the MRC unit leaders, and for advisors. And these have a lot of great examples, a lot of great information on how to go about doing this work together. And if you are interested in engaging youth, I certainly encourage you to look at those different modules to see how you might best engage MRC volunteers and youth partners. So I'm going to stop there and turn it back over to Jennifer. I hope we have a good amount of time for questions at the end. But I do want to close, just like I started, and saying thank you. Your work really is appreciated and valued. And just about every day I'm able to share stories of what MRC volunteers are doing really to benefit your communities. So thank you very much, and I'll turn it over to Jennifer now.
Thank you, Captain Tosato, or I call just Rob, because I had the pleasure of knowing Rob for several years, since I've been in the program since 2003, and I can't believe it's been that long. We both had the opportunity for the 10-year anniversary to do a co-presentation, also with the health director at the Fairfax Health Department, some other state leadership about the past 10 years of the MRC. So it's nice to be able to pick that up and see some of the new transitions that we've made. I've been able to piggyback off of Rob's presentation quite a bit and bring the Virginia flavor to it. And been spent a good 8 to 10 hours digging through pictures, and I feel like the proud mother of Virginia MRC. That's what a lot of the other coordinators would say, that it's just really cool to see the progress that we've made, and I'm excited about the future that we have. So let me share a little bit of that with you, and I'm hoping that some of the volunteers that are on the line are going to see pictures of themselves, because I am opening up the photo album and sharing those and telling a little bit of stories as we go along. So here we go. So the mission of the MRC in Virginia is that we have community volunteers prepared to support ongoing public health initiatives. Kind of noticed that that's a little first, and emergencies in localities throughout Virginia. And our tagline is, volunteers protecting Virginia's health. And we really see the MRC as an extension, an extended part of the public health team at the Virginia Department of Health, and really hope that when you go and you participate in an MRC activity and you're working side by side with one of the health department staff members, that you do feel a part of that team, because we do value as a part of our team. So as Rob is going through his presentation and talking a little bit about the evolution of the MRC, I did some digging and found the 12 kind of MRC units that were a part of that demonstration project. And actually, as we went through the history several years ago, the Fairfax MRC, the concept of Medical Reserve Corps is new, was kind of new to the Fairfax, because the Fairfax MRC developed a medical response team before the MRC program existed. So I'd say, probably at the same time as conversations were being had at the federal level, there at the local level in Fairfax, they were having those conversations. And it's interesting to see that the localities that are listed here of the 12 are not necessarily just ones that are focused on mass dispensing or, truly just on emergency response, but, out in the southwestern part of the state, a little bit more in the rural areas we see represented here. And what we have from those 12 is just a wonderful group of, I say, red shirts. I know a lot of the MRC units wear different colors. I think we have some light blue shirts, but for the majority, everybody wears the red shirts and has the MRC logo, and I really think that it brings us together as a team. And even though we might be individual MRC units, I see wonderful cooperation amongst the units and volunteers with the Virginia MRC logo with their individual units' names across them, all working together as one big team. So when we started to evolve at a state level, it was really important that we put some structure in place that would allow the MRC unit development at the local level to be able to make some really good steps. We were fortunate that the State Board of Health at VDH made a declaration of interest in the MRC very early in the program. We were able to utilize that interest and passion to provide and write in risk management liability coverage for MRC volunteers specifically, and that is actual in code of Virginia. And then we do, and even more so than we did at the very beginning, utilize the federal grant funding that we received from preparedness from CDC and the Assistant Secretary for Preparedness and Response to fund and support the MRC program. So as we've evolved, the state has actually used much more of that funding to support the MRC program. And then they actually created a state volunteer coordinator position, because at the very beginning, there wasn't a state volunteer coordinator. So when we were looking at building, we did really take some time to think about that infrastructure. I mean, even it was a group of MRC unit coordinators that sat together in a room and came up with our shared mission. And we try to really share best practices in recruitment. One of the large strategies that we use from the very beginning and continue to use is that when a healthcare professional renews their license, they can indicate if they're willing to volunteer in a public health emergency. And we have the opportunity to receive that information and follow back up with those volunteers. So perhaps you're one of the doctors or nurses that checked in that box and heard from your MRC unit coordinator. We also want to develop some standards and training, the core competency concept, the main structure of what we want all MRC unit volunteers to know. That's been pretty steady throughout the years. And then really digging in and defining that purpose for the MRC unit where they are. And you're going to see as I give some examples that, what the MRC unit in Southwestern Virginia looks like and what in, Eastern Virginia looks like are different based upon those localities' needs. And I think that's very interesting, and it's meaningful for the volunteers, and it's really important for the community. We wouldn't be able to do it if every MRC unit was like McDonald's and it all looked alike. So in looking at that, we really wanted to figure out where the MRC fits in the ICS structure, Incident Command structure. And unlike, I think, some of the other states, in Virginia, MRC volunteers just fold right in. We don't work independently from the health department. We are a part of the ESF8 structure. And it's wonderful because it allows us to do much more and to work side by side within public health, and it's seamless. So I think that there is a lot of benefit to that. I'm sure that Rob is probably shaking his head yes. We are fortunate to not have some of the challenges that a lot of other MRC units across the nation have. And then we try to build capacity for volunteers to teach other volunteers, share their skills as healthcare professionals, and teach CPR, or maybe even we have some volunteers that are epidemiologists, and they've started to teach Category A agents to the volunteers, really to start to create that core and bring everything together. And, you know, as we mentioned, MRC really was founded based upon 9/11, and especially hit hard with Virginia that, you know, the anthrax scare attack that happened was in Northern Virginia area. So our focus as a metropolitan area, as what we call Cities Readiness Initiative, has been heavily focused on mass dispensing, pills and people. How do we work really quickly to put pills and people? That's labeling bottles, it's handing them out. That's what our work was, you know, mainly focused on at the very beginning. And many of you volunteers might have worked in the gymnasium or have in the past. Worked in the gymnasium where we handed out M&Ms or Skittles as fake pills. And, you know, we've been doing that for a long time. And I think that we've really pretty much put a good check in the box for that. If you look at some of the evaluation that's done for strategic national stockpile and medical countermeasures, Virginia usually gets in the 97%, and statewide we have gotten 100% for the past 4 years. So you are a part of getting that 100%. And as we looked at how can our MRC unit impact the local community and what are the needs of that local community, we've developed some really unique engagement opportunities and resiliency building opportunities for volunteers. This picture here, I actually was able to take that picture, is Dr. Tate, and you may have know him. He works with the state animal response team, but he's also a Peninsula Medical Reserve Corps volunteer. And we work together with environmental health and our emergency management and started doing free rabies vaccination clinics to our community because in Peninsula and Newport News area, well, it's near the water, likely to flood. We have to evacuate. People don't leave unless they have their pets. And in low-income areas, they may not have the money to get rabies vaccinations, and we don't want dogs with rabies in the shelters. So let's fix this problem. And we were able to get the donations and use volunteers and do some really great work in the community, and that is spread across the state. A good idea that's come about has other MRC units are doing it within the state of Virginia and the nation. And then Katrina happened. And I think that this really opened up something that we weren't thinking about for MRC. It was big. You had that passion of, I really want to go and help, not too sure how to get there. And we weren't too sure how to get you there either. And Captain Posada worked with the state, and we figured a way out to make it happen, whether or not it was with Red Cross or working with U.S. Public Health Service. But we did send some volunteers from Loudoun and out in Southwest Virginia. I sent some from Western Tidewater to support the medical aspects of Katrina. Oh, I hope that didn't stop. We were able to send volunteers. We had volunteers who worked in free clinics outside the French Quarter for several weeks at a time, and really had a great opportunity. It looks like my screen's back now. Sorry for that. a great opportunity to make impact in a national level disaster. And so we've kind of been constantly chipping away at how do we do that again? We want to be able to do that again. And how do we connect the dots? So I think we're coming up with a solution, and I'll tell you a little bit about the evolution of that solution. Okay, that rhymed. So when I started as the state coordinator, I was a data guru, so I started collecting a lot of data and information about the MRC and really figuring out, what is our capacity and capability. At that time, we had 27 MRC units. There were several areas in the state out in Central Virginia, West Piedmont, Pennsylvania Danville, Allegheny that did not have MRC units. So we had a little bit of a gap there. And we had 9,850 volunteers, which that's a lot. It's a lot of volunteers. And a lot of them were recruited specifically for the points of dispensing. But we really wanted to get out in the community, and I would say that, I don't know, at least 2 to 3 times a week, we have MRC units that are actually going out for community events across the state. And whether or not it's sharing about tick-borne illnesses or preparedness messages, we started getting out there in the community. And also identifying how can we use our retired, maybe public health nurses or nurses to go out and fill in areas where the public health nurses that originally they could go out and do free health screenings in the community were having to be pulled back, and they could not do that any longer. And health directors came and said, hey, can we get the MRC to go out and do these blood pressure screenings? And sure enough, we were able to train volunteers to be able to do this. And that's Carolyn Conley, and she went to Minnewood Retirement Center the last Thursday of every month from 3 to 4 and did blood pressure screenings there for that community. And we hadn't really had a big emergency in the state for us to respond to until March of 2008, when in Suffolk, there were several tornadoes that went right behind OBC Hospital. It's pretty outside suburban, but it's a pretty rural area. As you can see, where the volunteers and the MRC unit volunteers are standing, that was actually the foundation of a house. This area was, not 100% flattened, but there were significant structural damage, and we were lucky. We were very lucky that this happened during the middle of the day when people were at school and at work, and there were no fatalities for this. But we had volunteers there doing first aid on site. Volunteers gave tetanus shots, and that was beyond what we thought MRC would be doing. So we've constantly kind of made some baby steps and gone, forward with that. For 2009, 2010, my charge was to be 31 MRC units and done. We increased our volunteer bit, a couple hundred volunteers, and expanded our area that we started to cover. Captain Tassado might have probably been here at this. We were able to send some volunteers in the development of a federal deployment cadre of MRC volunteers. We have volunteers that got the experience, some of the experience that they would have had they gone to Katrina, and were being trained to do that. Unfortunately, we hadn't been able to really mobilize those volunteers, but I think we've got an even better solution to be able to do that now. And it goes without saying, every MRC volunteer in the state of Virginia at some point in time has been asked to support a mass vaccination clinic. If you have not, you just haven't been a volunteer long enough, because it is really the bread and butter of what we do frequently. And at the very beginning in 2009, not only were we looking at influenza, but we were also are doing vaccinations for smallpox. At that time, we were focused on that as a potential disease that we wanted to be able to vaccinate against. And we took vaccination outside of the clinic setting. This is the bottom of City Hall, and we had MRC volunteers staff 90% of this clinic and give flu shots to fire and rescue. We had volunteers that gave flu shots in the rescue squad bay as community members drove through. And then we looked at dispensing in a very unique way based upon what the community was, and thinking outside of that medical countermeasure, come to the gym and get your pills. In some areas, this is on Tangier Island, you have to take a boat to get there. So it's walking door to door and handing pills out. So it's different in every community. So in 2010, it was 31 and done. See, we've got a good uptake in volunteers there for 11,400 volunteers. And that was right about the time of H1N1. And it took us to, I'd say if it's a highlight, it definitely is a highlight of what we were able to do, and really demonstrated the capacity and the capability of the Virginia Medical Reserve Corps, without a doubt. We had volunteers that were willing to stand by the side of the road and hold out signs to get people to come in and get their flu shots. We had volunteers that worked one-on-one in clinics, doing education about regular cover your cough, wash your hands, stay home with sick, and did that out in the community. We had volunteers that stood in line as people waited to get their free flu vaccine to do just spreading that message. And we were able to engage some of the students in helping us in mass dispensing. These actually are hostess students from a local, I think it was a community college that had a nursing program. So they came in and helped us do inventory to support the mass vaccination clinics. And we were able to utilize over 2,000 volunteers to support H1N1 vaccination activities. And there was over 700 activities statewide, and the monetary value for all of that was over $825,000. That is huge. And when I can articulate those numbers, and when the state health commissioner gets her flu shot from an MRC volunteer, and when Captain Tosado gets his flu shot from an Alexandria MRC volunteer, that speaks volumes. It really, really does. So in 2011, we continued to do the recruitment. We had 12,100 volunteers, so that uptake from H1N1 continued to go. And then we really started to look at, okay, points of dispensing. Okay, we're doing that. It's good. We're 6 years in, for some units are newer. But can we get outside of the pod box? And is that an autopsy suite? Well, yes, it is. And it's definitely not a pod box. But we started to bring MRC volunteers into the autopsy suite in the office of the chief medical examiner, and this was a wonderful collaboration with the chief medical examiner into developing teams of volunteers that were trained and that are ready to augment OCME operations either within the office or at a mobile morgue, and I do have some pictures of that. So we were the first MRC unit in the nation to actually develop the mass fatality response team. I haven't pulled the numbers recently, but we were about 160 volunteers that have completed those the training requirements, within the state of Virginia. So kudos to you guys. I have great admiration for the individuals that can support this, because I personally could not do it, and you guys you rock. And then we started to develop some better relationships with our hospitals, and they started looking at how could the MRC help us. And we actually, in Virginia Beach, had the Virginia Beach General Hospital come to the Medical Reserve Corps and say, we're doing this exercise in coinciding with the Rock and Roll Marathon to do surge within our hospital, and we would really like to see how we could integrate MRC volunteers into it. And it was pretty small at the time, but the value was huge, and they saw it. And it really has blossomed in the use of volunteers in the eastern region to support very large events. And I do have some great examples of that. at the same time, we're trying to find out where that niche is for MRC volunteers in shelters. We're not the Red Cross. We don't set the shelter up. That's not our gig. We're ESF 8, so public health and medical. Where is that? Well, that responsibility really is providing that first aid support there in the shelters and helping with people that have functional needs, that have mobility issues, that need, medication monitors. And we started to train volunteers for that, and this was actually in Virginia Beach in June. And then, we had Irene. And so just a couple months after we put that training in place, we were mobilizing volunteers to support the shelter operations in the Eastern region. How, important that was, and it's great that we have been able to get the training and then immediately use the volunteers. So in 2012, we still had that 31 units, and we had 12,795 volunteers. I'm going to skip past the next video real quick. So we looked at medical surge, and the small on-site surge that we had in the hospital with Centera moved and blossomed with the Rock and Roll Marathon. We started to integrate volunteers within the mobile ER. It was the first time that the hospitals in the Eastern region had set up a mobile ER with full capability in the basics tents, which some of you may be familiar with. And they saw 105 patients. They maintained emergency standard of care outside the hospital. And thanks to the care that's been provided at the Rock and Roll Marathon, there were no deaths associated with the race. And one of the great things that we like to see is that when you walked into that tent, you couldn't tell the difference between hospital staff and MRC staff. And we were able even to have one of the MRC volunteers that is the physician, we had him credentialed so that he could have the privileges for the hospital and to be able to provide even a higher level of care than typical MRC volunteers would. So also along the raceway, we had first aid stations, people called sweepers that would pick volunteers or pick runners up that had passed out or needed some care along the way, if it was fatigue or hydration, and they would help to do some triage and some minor first aid along the route race. So that was really a growth and an evolution of providing that medical surge and working side by side with the hospital. And here we have a picture of Homeless Connect. Don't have any pictures of the homeless members in there because we're not allowed to share those pictures. But we were able to take the points of dispensing concept, the way that we are able to process people through and get pills to them, and apply it to bringing homeless community members into a process where they got free health screenings, where they were talking, they had blood pressure screenings, we had podiatry screenings, the STD, they had their vision checked. Here they're doing the cover the hand and cover the cough and wash your hands, and there's a glow germ container over there, body mass index, weight, really to give that health screening. The MRC played a small role. Now the MRC in the Eastern region with Norfolk as the lead plays a huge role and pretty much runs all of the health screening process for the Homeless Connect, and it's expanded to other things like the dental screenings that are provided for individuals in the community for free. Doing great work, and I think that's a very meaningful opportunity for volunteers to help the people that are less fortunate, to have those conversations, to let them know and that there's people that care about their health and we can help them find resources. So in 2013, we did have a big uptake of volunteers. We're at 13,447 volunteers, a very strong group from that 9,000 that we started with at the beginning. And we were able to do something that I don't think we thought we could do. And my my philosophy is, well, you know, all things are possible, and let's just go ahead and see if we can make it work. We were able to deploy volunteers that were nurses to the inauguration, and they helped to augment and staff medical tents with U.S. Public Health Service and National Park Service. The volunteers fell into that ICS structure that I talked about at the very beginning, did medical ops, were under the direction of the National Park Service, and they went there and did good work, either working within the tents or walking amongst the individuals that were out there on the mall and providing medical care. We made something happen of deploying volunteers from the state into the district of DC, but also to augment feds. And that had never been done before. And I think that's a huge kudos and a feather in our cap that we were willing and able to do that. So we started that development of the mass fatality response team and did the training, and then we would like things to grow much faster than they normally do, but in 2013 we had a very large exercise at the Richmond International Airport, and we did a mobile morgue exercise. And when I sent out the alert for this to the 150 volunteers, we were incredibly just impressed by the willingness of volunteers to drive from Fairfax in Northern Virginia on a Saturday to come to Richmond to play in a mobile morgue and to do this exercise. And I actually had to screen individuals, so we only had 2 from each MRC unit participate because we only had 16 slots. So that shows that people are willing, we're building that capacity, and we've got that capability. So working in the mass fatality is, tracking bodies, tracking clothing and articles, documenting, doing x-rays, trying to do identification of the individuals using dental records. It's really all aspects, and we've been able to have volunteers intricately involved in that. So the next thing I'm going to show you is actually a really cool advertisement that, in partnership with the MRC National Office and the National Association for County and City Health Officials, we partnered and did a short promo for the Medical Reserve Corps. And there are a lot of Virginia MRCs, and there's some MRC units. I'm not too sure which other MRC units there are, but I know there's some from some other state. We had a lot of volunteers involved, and there was a lot of coordination, but I really wanted to show you what I think is another feather in our cap and a big star, some of the work that we did. And you'll see the Prince William, and you'll see the Fairfax and the Loudoun logos as we go through this little video. So hopefully the audio will work for us. Really? No, it's not going to work. Okay, that's not going to work. What we'll do is we will go ahead and send everybody the link, or actually I'll post it up on our Facebook page. It worked earlier, so I'm sorry that it didn't work now. So we'll post it up on our Facebook page, and you can take a look at that. But it was wonderful that NACHO and the program office were able to find the opportunity to develop the videos to promote the MRC program, and we were more than happy in Virginia to support that and to become stars and representatives of the MRC program nationally. So in 2014, we still had that 31, and our numbers started to drop a little. So we went from 14,000 down to 10,707, and we really started reassessing. We've been around for 10 plus years, 11 years, some units. Are you still there? Do you still want to volunteer? Our mission's kind of changed. We did what we call data scrub and cleanup. And so it's kind of disappointing to see the numbers drop down, but I feel like the people that we have on the list are people that we can really know are there and are more willing and are really building that capacity. than just having a lot of people on the list. So you'll see the numbers for the last 3 years have pretty much been about the 10,700, 10,600 range. And we started doing more training for functional needs. We actually have written and expect and hope that we'll be able to call in the Medical Reserve Corps when we have to do state-managed shelters. There are several of those around the state. And there's very long shelters that are set up for, 2 weeks to a month, similar to what happened down in New Orleans and what happened in Texas. So it's going to be a much longer and a different situation than the short shelters that are set up post a winter storm. And we'll be looking at a larger capacity than what there would be in a short-term shelter. We really want to see some training happen that will really get volunteers ready to support that type of activity. And in the southwestern part of the state, the Mrc Volunteers have supported a biannual event called Drug Take Back. And they've been able to partner with safety officers and pharmacies to collect and properly dispose of unused over-the-counter prescription medication. What started out, I think, is 8 locations, and the last one this past fall was, I think, 14 locations. They're looking at in spring and April being 12 to 14 locations, collecting over 1,000 pounds of medication. And for this area of the state where prescription drug abuse and suicides are at an epidemic proportion, it is a serious community public health concern. And they've been able to become active members in that community, doing great training to address that. They have volunteers that are taking suicide education and outreach training. And, Christina says they collected over 3,000 in Southwest Virginia. She'll be able to tell you better statistics there on the chat than I will. And Christina's the Mrc unit coordinator out in Southwest. And just say they're doing really great work, and it's unique to their community, and that's what we really like to see. We've done disease investigations for just about everything, I think. TB, measles, fungal meningitis, actually out in the southwestern part of the state near Virginia Tech, and most recently Ebola. We were really planning to figure out how we were going to ramp up and continue to ramp up for Ebola. Just like with H1N1, we didn't know how bad it was going to be. And there was no doubt in anybody's mind that MRC was going to be involved in it. And they were. Some of the health districts in the northern region did not have as many people to be monitored as others, but in the Fairfax Health District, they did. And we have volunteers that helped to actually call individuals twice a day to see how they were doing, and did great work where public health staff, they couldn't do it on weekends or on a holiday. And it was a great partnership in building and expanding our capability to be able to do disease investigation and prevention and monitoring. So just want to do a plug that March the 1st, we're going to do another statewide training. I think it's going to be video teleconference right now. It might change. And we're going to have a wonderful team from the state and the disease and surveillance investigation team from the state level, from regional, and we're actually going to have one of those Fairfax MRC volunteers that have been working on Ebola come and tell us what they were doing and how did that evolve in the state of Virginia. So if you're an epi nerd and you really like that, I encourage you to participate in that training. It's a little side commercial. So where are we now? At the end of last year, we did a lot of transitioning. We had 31 units, and now we're at 27. Why is that? What are the changes? We started to align ourselves more closely with the hospital preparedness program. The MRC program is, I would say, 70% right now statewide funded by the Public Health Emergency Preparedness Grant. I'm paid for the grant. All of the MRC unit coordinators, I think except in Fairfax, except in Fairfax, are all grant funded. So we really have to make sure that we meet the capabilities, and we work with both sides of both the hospital preparedness and the FEP grant. And the capability that we do is volunteer management. It's number 15. They tell me it's not at the end of the list because it's not important, because they all know I'm pretty passionate. They say it's at the end of the list just because alphabetically that's where it ended up. So we have some MRC units that had combined together in a regional MRC unit. Out in the Southwest, where it took much longer for the MRC units to become an MRC unit, they have all merged into one called the Near Southwest MRC unit. You see that it has just about the same amount of volunteers as Christina Morris's MRC unit in Southwest Virginia. We have coordinators that are now full-time coordinators that are covering multiple MRC units. And this is a great transition for our program because the capacity is now meeting the staffing needs, and we're seeing more sharing across the region of activities. And volunteers are, really working more closely together because we just don't have individual people. We have more regional coordination. And so you see the different regions there. We have the far Southwest, the near Southwest. We have Northwest, and then we have the central region. There's kind of South Central that we call it. We have 3 different coordinators. We have an acting coordinator. Okay, y'all are saying next slide, and I'm already on it. Oh, it said screen sharing has stopped. Okay, it started. Let me go back. Y'all got the map now? The map is important. All right, message me you got the map. Yay! Okay, we're good. All right. It might take a little second for your computer to catch up, and we change screens. So we got the map, and I do have the MRC unit coordinators' names on the map, so you can kind of see the different areas. I have some shading. It's a lot of information. The numbers there for how many volunteers are in each unit were from the end of September. I'm working right now on the end of the year report. So you can see where your coordinators are. You can see how many volunteers that are in that unit. The only acting that we have right now is in Alexandria. They are, I think, interviewing this week. No, wait. They offered their MRC unit coordinator this week, and hopefully we'll have that person working in the next 3 weeks. They are interviewing in Richmond City for that position, so we'll have that position filled. And yes, the Fairfax MRC coordinator is acting. Paula is, but Paula is a rock star, and she came from Alexandria, so I'm 100% confident that Paula is doing a great job holding down the fort in Fairfax. But what I would say by the end of this month, or definitely by the end of February, it'll be the first time that I ever remember that we're 100% staffed. And I'm really excited about that. And if you haven't had a coordinator in a while, I hope you're excited about that too, because the new people that we've brought on board are super sharp, have MPHs, and are very excited about the program and are learning from the new varsity coordinators, and they're really bringing in a breath of fresh air. So it's a good time for Virginia MRC. We've kind of gone from a maintenance mode, and I think we're getting ready to kick it off into a little bit more of an engagement mode. So let's talk about today and tomorrow. These slides aren't as exciting as my other slides because there aren't pictures. But it's to build that capability, to be able to show that we can. And you know what? I couldn't say today. Well, it was this past weekend we showed capability. How about that? If you are in Rap Rap, Blue Ridge, New River, Roanoke, Henrico, Crater, Prince William, Rappahannock, Thomas Jefferson, Central Shenandoah, Lord Fairfax, Three Rivers, or Richmond City, you might have gotten an alert through the Virginia Volunteer Health System asking you if you would be available potentially should we have to set up shelters for the winter storm. And it was a great opportunity, one, to exercise our system, but we really did need volunteers. We really were planning on it. And so as we sent out alerts, and some of you might have gotten an alert once, you didn't respond, and you got another text message or another email, that we were able to roster up 240 volunteers on standby that involved 13 MRC units. And so what I was able to do at the state level was to monitor that. Twice a day, I provided feedback on what status each of the MRC units were in and how many volunteers were available and who had signed up, and even how many medical were available. The only MRC unit that we activated volunteers for was in Prince William. There was a roof collapse on, I think it's an assisted living facility, which had to be evacuated, and a nurse did go over and help with some transition and making sure medicine was dispensed correctly. So certainly it could have been much worse, although if you are in Northern Virginia and you still can't get out of your driveway, you'll probably tell me that you're going have cabin fever, and it is pretty bad. But my snow's melted here in Virginia Beach area, so it's not that bad for me, but it could have been a lot worse. But we were ready. And to be able to show those numbers and to be able to send that up on situational reports really says, hey, we are capable, we're standing by, ready to respond. And we keep learning from these events. We keep learning, from this past winter storm. We learn from the exercises that we participate in, learn from the Rock and Roll Marathon, the Shamrock Marathon, and continually try to improve, our capability. And expanding and addressing accessibility to health services, working with the homeless population, veterans, really trying to engage community members or the Spanish population and make them really more of a part of public health and to bridge those gaps. And we really see MRC volunteers as public health champions. You have the ability to go out in your community and carry that public health message. And word of mouth is the best form of communication and to get people to understand and change their behavior because they trust you. And that very casual conversation is very, very meaningful. And so I know that Dr. Levine, our state health commissioner, actually I was in the office a couple weeks ago, and she walked up to me and asked, I really want Virginia to be the healthiest state. How can we do that? How can we make a healthy and resilient Virginia? I want MRC to be involved in that. We need to make this happen. So I'm not quite sure what all of that is going to look like, but I think that, the Million Hearts campaign is going to be a part of that, working with the HOSA students, working regionally with our healthcare coalitions, with our other MRC units, is all going to be some of the pieces that are going to make that happen. Captain Posada mentioned the mission-ready packages. Perfect, because we've always talked about how we mobilize volunteers outside the state of Virginia. And Virginia's response is that we would use the EMAC process, Emergency Management Acquisition Compact. I think that's it. Oh, too many acronyms. We would use the EMAC process where a state could ask another state to help them out, and we put together a package that would be what they requested. So we're basically pre-packaging groups or resources to be able to fill people's need instead of just getting very undescript, not complete requests for support. In Virginia, the two areas that we'll be working on for the mission-ready packages that our senior leadership has decided we should focus on is mass fatality and radiation response. We started some development of a radiological response team, and some politics and changes in administration kind of put that on hold. But I think that the mission ready packages is really gonna start to kick that alive again. So stay tuned about that. Community medical surge, I'm hearing there's Eastern Shore doing the rocket launches, and they're setting up first aid tents, and they're doing teams. And out in Southwest, or near Southwest, they're looking at the Martinsville race and other large community events where we don't want EMS putting Band-Aids on people or providing water or making sure people are hydrated. We want them to help do transportation of individuals and do higher level triage. But we have some really awesome and caring community members that can do that frontline medical care. And if it's, at the Peanut Festival or Shamrock, there's a lot of different venues, but I think overall the state, there's a great opportunity to use volunteers for medical surge. Public health screenings, I mentioned blood pressure screenings, and that's, I think, working with the BMI, height, weight, vision screenings, pre-screenings for physicals for students before they go to school. We do a lot of that, and the MRC has constantly been involved in that. I know that there's looking at developing specific teams that would focus on that in the community. The Epi Outbreak team is a huge need, especially after Ebola and everything that we've been working on. Some areas don't have as strong of an epi response team, but I'm hoping what we'll do in March, if you listen to Ebola and you listen to the state epidemiologists talk, that we'll be able to pique the interest of a lot of volunteers, and we'll be able to develop more epi response teams statewide, because we already have some really great models. And then county captains or unit leaders, we're looking to develop individuals within the MRC unit that can help lead the MRC units. You saw we've gone from 31 units to 27 units now. We've got coordinators. It might have been 3 coordinators in that area, and now there's 1. Really need for people in the community to step up and be leaders. And we'll be looking for volunteers to do that. Southwest, out in Southwest, and Christina Morris's program is piloted the County Captain Project, and they have a wonderful model out there. And I know in some other localities in the MRC unit, they're starting to take that concept on as well. And, getting the message out for community preparedness helps us to build more resilient communities. And I have to tell you, it's pretty darn creative when we have volunteers out on the beach, the Eastern Shore, handing out sunscreen, but also handing out emergency preparedness information. So I always say there's no wrong date to get the message out, and there's really not very many wrong ways. And just recently, one of our MRC unit coordinator, who's a new unit coordinator in Rappahannock MRC unit, Jordan, she's rocking there, and she does Rappahannock and Rap. And she came up with a senior preparedness bingo. Rob, this rocks. I'm telling you, this is really cool. They use pictures and do bingo and work on winter preparedness with pictures. And seniors like to do bingo. And it is a very engaging way for volunteers to help convey that message to the senior population, who, by the way, have probably been stuck in their house for 3 to 4 days because they can't dig out. And we wanted to make sure they had that medication, so they had the oxygen that they needed, they had the plan, so that they're not calling EMS asking for a transport to the hospital, because we were seeing that. And by reaching out to the senior citizens and help them better understand why they need to be prepared, helps to alleviate unnecessary medical surge on hospitals that need to provide a higher level of care. So it's really great to see some very creative ways that MRC volunteers are doing preparedness education and building the more resilient communities. So our state health commissioner, Dr. Levine, has set a very high goal for us, and she says she wants Virginia to be the healthiest state. That's a lot of work. The healthiest state in the nation. And without a doubt, it's not going to happen without you. So we're working through looking at some of the strategic plans for that, integrating the national public health security strategy, all of the big picture planning and bringing it down to what does it mean for Virginia. And I think it's going to mean good stuff for Virginia. I think it's going to mean a lot of unique and important engagement opportunities for volunteers in Virginia. So how do we make all that happen? There's aspects of volunteer management that I really see as a focus for this upcoming year, kind of building upon what we've already done. I think we're going to see some more coordination with hospitals. Perhaps you as volunteers might have the opportunity to work in a regional hospital coordination center, to participate in exercises with the hospitals, to do flu vaccination clinics at the hospitals. So I think I know we're going to see a tighter, I don't think, we are going to see a much closer relationship developed with our hospital partners. Spontaneous, unaffiliated volunteer management. A lot of the coordinators know SUV management is like one of those things I constantly harp on. Know we're going to try to get volunteers involved in helping with that. That's all the people that just walk in the door that are nurses and doctors that haven't become Mrc volunteers, but they want to help. And then we have to figure out, oh my gosh, we've got to get you oriented, and we have to get you credentialed, and then we have to mobilize you. Norfolk, within, I would say, the last 4 months or so, did a spontaneous, unaffiliated volunteer exercise, and it was entirely managed by their volunteer staff. Their volunteers were incident command. So I think we'll see more of that. Student engagement, we've always had a strong relationship with HOSA. Really, this next coming up, or in March, is the State Leadership Conference. I'm presenting. We have several volunteers that are judging and really involved in that. We have some of the MRC units have developed partnerships with our unit, and they'll be presenting at that State Leadership Conference. So we're continuing to look for opportunities to work with HOSA and other student organizations. And this year, I think we're going to be focusing on expanding our healthcare professional volunteer base, since we're looking at that medical surge and looking at our capacity to do epi outbreaks, wanting some more healthcare volunteers. And we've got some strategies for recruiting more registered nurses and LPNs, and we'll be doing some recruitment campaigns for that. So what really makes the Virginia MRC rock, or as I say, we're awesomer. We really like to be the model, and when often we go and I talk to other state coordinators, they're impressed by you. They're impressed by what we're able to accomplish, that we have wonderful senior leadership support from the State Health Commissioner to Secretary Hazel, Secretary for Health and Human Services, and I actually had the wonderful opportunity, which I've never had before, no MRC state coordinator has ever had. I was able to brief the governor on the great work that you do. And that speaks volumes that even our state health commissioner would want me to do that on your behalf. So really cool stuff. And we have a dynamic group of coordinators. I hope you love your coordinator. And I think our mission is becoming clearer. It's becoming more purposeful. We're written into plans. It's not what are we going to do. It's we need to do this because people need us. And we want to respond, and we can respond. And I look forward to seeing us grow in very specific, meaningful, mission-focused ways in the next year. It's been an honor. It is an honor to continue to lead and represent us. I have the red, white, and blue just about everywhere, and plenty of red shirts. And we'll continue to do great work. Annually, Rob had put up some statistics. I talked about H1N1, and we often value what the MRC is. We actually count how many hours each volunteer does, put a monetary value on that. for every activity statewide and then come up with a combined monetary value. So the last 3 years, we've been between $850,000 and $900,000 a year for volunteer activities and support throughout the state. So, I would like to set the goal that in 2016, we hit the $1 million mark. I think we can do it. It's going to be doing more in the community, doing more great work, but that's what I would like to see. I would like us to see hitting the $1 million mark. So I've put the challenge before you to become more involved in your community, to work with your coordinator, to answer your alerts in the Virginia Volunteer Health System when you get the emails and the text messages from your coordinators. And most of all, I just want to thank you for what you do and for volunteering, to take your time to listen to Rob and I talk tonight, to go to your orientation, to meet your coordinator, to work with the public health staff and become, impactful people in your communities, because communities don't change unless people care. So it's a great honor, and you do great work. So I just kind of take it from here. We're going to do one little thing, and then we do have about 20 minutes or so to answer some questions. We'll let Adrenia ask the questions that you've put in the box if Rob or I haven't answered them as we've gone along. We do want to make sure we kind of know who was here. It's a little hard doing webinars. We don't have a sign-in sheet. So our sign-in sheet is going to be two different ways. One, if you can get to that chat box, I want you to type your name and your MRC unit in the chat box. We can print that out, and that'll be our virtual sign-in sheet. If you can't do that and you want to make sure we know you are here, you can email us at virginiamrc@vdh.virginia.gov. And within the subject line, you have to put Virginia MRC Rocks in the subject line. And then we'll kind of compile that. If you're registered in the Virginia in Virginia Train, we'll make sure that you're verified there as participating in the training. We'll also provide a roster to all the unit coordinators. So where do we go? Home base is virginiamrc.org. If you go there, you can update your profile in the Virginia Volunteer Health System. And if ever you have any questions, please definitely contact your MRC unit coordinator. So I'm going to hand it back over to Adrenia to kind of facilitate some questions, and Rob and I will do our best to answer them for you.
Okay, thank you, Jennifer, and thank you, Captain Tosato, as well. We got a couple questions, a couple minutes left. One question: will the presentations be available?
Yeah, we're hoping to record the presentations and actually do it on a webinar. I can work with Captain Tosato and maybe can turn them into a PDF that people could access. We'll work on that.
Great. And this is Rob. I'm absolutely share my slides as much as you want.
Okay, great. Thank you all. Next question: has an annual conference for the VA MRC volunteers and speakers been considered?
We have an annual conference for the Public Health Emergency Preparedness Program. It's the programmatic staff. In a couple of years, in the past, we've been able to bring a few volunteers to that. Unfortunately, it probably comes no surprise to many of you that our grant funding has been cut in the past significantly. We had a lot of funding during H1N1, but that was the days of a plethora of having deep pockets, and we don't have that anymore. What I hope we'll see is that there are some regional training opportunities and regional conferences, perhaps. I don't think that we would be able to do statewide. We've actually even gone from doing video teleconferences to doing webinars for statewide meetings. But talk to your unit coordinator about what you would be looking for, give them some ideas, and there's no wrong gate. We can talk it out, but unfortunately we don't have money to do it.
Okay. Next question: any updates on the Zika disease?
I am not qualified to provide updates on the disease. However, if you go on our website, vdh.virginia.gov, it is on the main page. and the state health commissioner yesterday sent out a letter to all healthcare providers in the state. And yes, I do know there has been one confirmed case from Virginia that came from somebody who traveled from those countries with it. I saw that popping up in there. So what I'll do, if you're on Facebook, I'll put the commissioner's letter out to healthcare providers up on our Facebook page and provide that as a resource. And you can go to the VDH homepage, and all the information is there as well.
Okay.
This is Rob. I'm not qualified to answer that specifically as well, but I know that the CDC, Centers for Disease Control and Prevention, had a webinar on that. I believe it was Tuesday, specifically on an update on the Zika virus. So you could go to the CDC website as well for that information.
Great.
And, you know, and it's great to even hear that question asked, because I think that public health is more prevalent and it's talked about more in media than it has in many, many years past. And when I walked into my house and we had the news on, they were talking about it. And so I think that that's great.
Okay. Another question, and this should be the second to last. Who's in charge of the mass fatality team? I believe that's what the question is.
Yeah, so the mass fatality teams aren't like individual units. They are teams that are based within the Office of Chief Medical Examiner in the district offices. So we have 4 district offices. There's one in Manassas, there's one in Roanoke, there's one in Richmond, and there's one in Norfolk. So if you want to be on the mass fatality response team, there is a set of training that you have to do in Virginia Train, and then you can sign up for the in-person courses that are offered at those district locations. You actually have to spend a day in the morgue and do autopsy 101, dental, and x-ray.
Okay. And we have one last question, and you all may have addressed this already. Is there any actions from the MRC to support the current water crisis in Flint, Michigan?
Yeah, this is Rob. I'll answer that. So we don't have a MRC in Flint, Michigan, or Genesee County, where Flint, Michigan is located. However, we're hoping very soon to correct that, and are hopefully going to be creating a medical reserve corps in that area very, very soon. That said, the state of Michigan has asked Mrc volunteers from across the state if they would be willing to assist with some of the response needs. And so far, none have been, I don't think any have been activated to do so, but they're certainly on standby to do that. Some of the missions they're looking for them is some of the general support with getting water to people, but then also more specifically in the public health side to do some of the blood lead testing, and then assisting with that process. Some of the information kind of flow that's needed there as well. So at this point, it's, as you can see on the media, it's a very evolving situation, but we do expect that the MRC will be involved here very soon.
Okay. All righty. I think that's all of our questions as well. I want to thank again Captain Tesado, the Director of Medical Reserve Corps Program, and also Ms. Jennifer Freeland, the State Volunteer Coordinator, for being our presenters on this evening. And we'd like to thank all of you all for attending our training session. Again, there will be more MRC training coming down the pipe, so keep your eyes and ears open for that information. And again, thank you. Everyone have a great evening.
Thanks, Paul.